Three of the head region. No any noise. Hey. You see no any noise. Right and move to B. But by the way, let me show you this. When the teacher comes to the class and see dirty white board, that is the dirty face of the students. I will agree, of course, it's not hard for me, but I think it is not hard for you also. Now let's continue. Operative surgery of the head region. Topic is really big, huge. I will do my best to finish it today. I'm not sure that I can do it. Even if something will not be explained, you will take the material and we'll start. I will give you today the most important specific keys, which you should know. And then, as you can see here, I put the 5 group of the surgeries here. First one, it is arresting of the bleeding. Why I start from arresting of the bleeding? Because that is the main surgical problem. Bleeding is the main surgical problem. It can be problem of the trauma, it can be problem of the surgical operation. That's if there are bleeding, we forget about anything else and we start to arrest the bleeding. Because if there are bleeding, but I will do something another, I will lose the life of the patient. I will kill him. Second, it is the primary treatment of the wounds. When I arrest the bleeding, that is the time to treat the wound. And I must do my best to make the treatment of it. And I will give you here the classification of the wounds. You will see which kind of wounds we have, what is the fractures, how many types of the fractures we describe in the head region. All these questions included in the wounds. Point number 3 is trephination. Trephination, it is the special surgical access to the cranial cavity. So I will show and teach you how we can open the cranial cavity. For what? What the necessity of this surgery, why we need to open the cranial cavity. Point number 4, it is the plastical reconstruction of the skull bones. Very big problem. We can lose the bones because of diseases, because of the traumas, because of the surgeries. And we will speak how we can reconstruct it and close this defect. And finally, we will speak about arthrotomy. Last my topics with you, it is especially about mastoid process, and we speak about shape of triangle, yeah? Let's start, right, please, name of first group of surgeries. It is arresting of the bleedings from head region. And friends, if you want to have satisfying education, all the knowledges which you will try to study, you must to classify, first of all. Because classifications help you to remember and help you to understand. So let's make classification from head bleedings. Right, please, type number 1 of the bleedings. It is the bleedings from soft tissues of the head. Example, friends. Example, you know very well because we study all the regions like subcutaneous fatty tissue of frontoparietal occipital region. It contains the biggest arteries. Of course, it can be source of bleeding from the soft tissue, yeah? So we will speak especially about this group, bleeding from soft tissues. Group number 2, bleedings from soft tissues and bones together. Bleedings from soft tissues and bones together, meaning the tension. Why bones? Because the skull bones, 8 bones, has the nucleic layer with the veins. So in the case of the bone trauma, bone fractures, we also will have bleeding. And it can be profuse bleeding, up to mortal bleeding. So you should be responsible to arrest the bleeding from the bones. Bleeding number 3, it is bleedings from dura mater venous sinuses. Let's say you see, guys, from superficially I go to deep. Yes. Firstly soft tissues, then bones, then dura mater venous sinuses. Unfortunately, here I write it in a little bit not correct sequence. Yeah. Firstly I write the bleeding from the brain vessel, then I write the bleeding from the brain. But it's much more correct to say bleeding from dura mater venous sinuses. Yeah, because it's more superficial. And finally, last one, it is bleeding from brain tissue. It is vessels and nerves of brain. Let's say this is the 4 groups, and I put here for you pictures, yeah, which is show bleeding from soft tissues, bleeding from soft tissues and the bones, dura mater venous sinus is the brain tissue. There's all type of the bleedings is shown in this picture. Right, please, bleeding from the soft tissues. According to information that inside of the soft tissues we have biggest arteries and big veins of the regions, bleeding from soft tissue can be mortal. Bleeding from soft tissue can be mortal. Right, please, there are 4 main methods to arrest the bleeding from soft tissues. Method number 1 and method number 2 we call temporal methods. One inside of the wound, second outside of the wound. Temporal method inside of the wound. Number 1, applying of arterial forceps. In the brackets, right, please, they can be 2 types. First, we call crushing arterial forceps, like Billroth, Hodger. Second one, we call occlusional arterial forceps. For example, the Black Oak forceps. What the difference between them? I imagine that in front of me there are the wound with the bleeding. I have arterial forceps. If I will apply crushing one, I should ligate and close this artery forever. But if it is big artery which is necessary to be recanalizated, I must apply the Black Oak occlusional one, because if I will apply crushing, I will damage the wound. After, we will have necrotization. Occlusional one just close the lumen, doesn't crush the tissues. For example, then you make operation on the heart, you close the vessels by occlusional clamps to not crush them. Because without these vessels, we cannot live. Do you understand it? That's a first method, arterial forceps. Method number 2, we can press the vessels by fingers inside of the wound. Of course, only in the operation room, in sterile condition. It is forbidden to do it in the street. In the street, it's forbidden to insert the fingers inside the wound. I think it's understandable. But in sterile condition, we can do. Method number 3, tamponade of the wound. We can insert the tampons, hydrostatical materials inside of the wound, and they will press the wound, they will close the lumen of small vessels, and will absorb the liquid. This is 3 methods: temporal, inside of the wound. Now, right, please, temporal methods outside of the wound. Number 1, pressure of vessels in projectional places. Hamza, which vessels we can press in projectional places? Vessels should have, Hamza, 2 characteristics to be pressed. Which characteristics is it? Number 1, remember please, vessel should be superficial. Number 2, near the bone surface. If these 2 characteristics is present, you can press the vessel. If even one from these 2 is absent, the vessel cannot be pressed. For example, look to me. My aorta located near the bone. Behind of my aorta there are the vertebrae, but it's not superficial. I cannot press it. In my anterior abdominal wall there are several vessels, very superficial, but they are not in the surface of the bone. I cannot press that. As I to press the vessel, again I tell you, they should have 2 characteristics. Point number 1, they must be superficial. Point number 2, they must be near the bone surface. Fortunately for you and for me, 99% of vessels in head region have both these characteristics. Why I say not 100? Because we have intracranial vessels, 1%. Vessels which is inside of cranial cavity. All another vessels which is outside, A, superficial, B, near the surface of the bone. That's a first temporal method outside of the wound. It is pressure in the place of projections. Method number 2, tourniquets. Tourniquet. You know what is tourniquet? Tourniquet, it is the belts or something rubber material, which we apply usually at extremities and press extremities to arrest the bleedings. How we can use in head region the tourniquet? Look here, please. There are special techniques of tourniqueting of the neck. How we apply tourniquet on the neck? One side we protect it by some strong material, for example, wood or metallical. And we apply tourniquet and press only opposite side. If you will press both sides, you will kill the person. That method use very short time, not more than 5 minutes, to stop the huge big bleedings from the source of the common carotid artery and its branches. What is happening in that case? Now look here, please. Tourniquet is applied approximately in the midpoint of your SCM. As I say you before, here we have very long process, transverse process of 6 cervical vertebrae. On the tip of it, we have tuber carotid. Then you press the tissues. Look to me. This is my transverse process. This is common carotid artery. Then you press them. Common carotid artery touch to tuber carotid and it's closed. Not more than 5 minutes, or it will give the destroyment of the brain. You will destroy the brain supplement. It's a maximum 5 minutes. You can close one side. Continue, please. Method number 3. It is pressing bandages. Pressing bandages. I think it's not necessary to explain, yeah? This is you apply the band. For example, in head region, there are trauma below the trauma. Why below? In the head region, guys, meaning the tension, all vessels have ascending direction. That's like the more lower you will make pressure, the more effective will be arresting of the bleeding, yeah? Vessels pass from down to up. For example, in the future, then I will speak about the caffeination. I will strongly say you that non-carotid tissues, which is called base of the flank, should be performed inferiorly. Not superiorly, but inferiorly. You understand what about is it? For example, I make caffeination. I want musculate the flap. Flap can have such kind of form or such kind of form. This would be stupid, guys, because all vessels pass from down to up. If I will keep the base upper, but lower will cut off soft tissues, I will destroy supplement of them. And vice versa. In that case, then base I form inferiorly. I keep the main sources of supplement. That's why remember, please, all vessels and nerves in head region have ascending direction. They goes from downwards to upwards. Let's say this is temporal methods outside of the wood. Right, please. Permanent methods. Permanent methods. Inside of the wood. Number 1, most usual method, ligation of the arteries and veins. Number 2, ligation by suturing. Hamza, hold your hand, finger like this. Now imagine that this is the artery or vein. What does it mean, ligation? I take the thread, I ligate it, then I cut this thread, and this artery will be closed forever. What does it mean, ligation with suturing? I take the same thread by with suture. Needle. I inserted needle in surrounding tissues, not inside of the vessel, but in surrounding tissue. Then only I ligate. What it gives? Fixation of the ligature. You provided ligature through the neighboring layers. Yeah, that's why it will be fixed here. Then you just only ligate it. You don't make fixation. Pressure of the blood can remove this ligature during the time. But then you ligate it with suturing, you fix the ligature in its place.
Yes, the tissue.
With the tissues, thank you very much. That's all right, please. Second method, it is ligation by suturing. Method number 3, it is suturing of vessel defects and recanalization of the vessels. Open the brackets and write, please, that is critically important for magistral vessels. Magistral vessels. What does it mean, magistral vessels? It is biggest vessels of human body, guys. It is stupid, for example, to ligate and close all of them. Common carotid artery, femoral artery, because without these arteries we can't live. If you will ligate it, for example, femoral artery, you must amputate it or lower extremity. If you will ligate it subclavian artery, you will amputate it upwards. And so in that case, I will teach you how we make vascular sutures. How we make vascular sutures. That is very important topic. Continue, please. Also, we can make the coagulation of the vessels using the special equipment, which we call electrocoagulators. Continue, please. We can use hemostatical sponge to arrest the bleeding permanently inside of the wound. What is it? Special sponge from fibrin. Then you cut the piece and put it in the bleeding place. It is glue these small vessels, lumen, fuse with them, and stop bleeding. In the brackets, right, please. Coagulation and hemostatical sponge can be used only for small diameter vessels. It's forbidden to use for big vessels. Okay? Continue, please. We can use the hydroxyperoxide, which is mere coagulation again of the tissues, and again arrest the bleeding from capillaries. That is the main methods inside of the wound. Now write, please. Principles of ligation of big vessels. Point number 1. Ligation of big arteries. Right, please. We can ligate it big arteries and inside of the wound and outside of the wound. What does it mean? I will explain you just now, right? And before I will start to speak now, guys, about principles of ligation, let's quickly describe the last method of arresting of the bleeding. It is permanent method outside of the wound, yeah? And then we will come to principles of ligation. Now, what will it look to be? Permanently outside of the wound, there are only one method of arresting of the bleeding. We call it ligation in distance. Remember this term, ligation in distance. In Latin, we say ligatio in distantium. Ligation in distance. For example, look to me. You are in a place of bleeding. I am the main artery which is supplying this region. I cannot work inside of the wound because of some reasons. By the way, there are 4 reasons why I cannot work inside of the wound. Reason number 1, 100 branches of artery. I don't have time to find each one. Or if I will try to do it, I will lose the leg of the patient. Reason number 2, inflammation wound. If the wound is inflamed, vessel walls stand soft. You apply the ligature, it is cut the vessel and come to outside. Reason number 3, burning wounds. In case of burning wounds, guys, you see all surface bleeding, not points of the bleeding, surface bleeding. Reason number 4, crushing tissues. Tissues with vessels is crushed. You don't identify where is the vessel to ligate. Mixture of everything. For example, train trauma. Crushing of the stem. What can I do? Now imagine that from me to you the tube is cut, which is called main artery. I can open this tube and ligate it before it is reached. It will be ligation in distance. What I must know to do it, projection and later of location of main artery. But you can now say, but sir, if you close main artery, what will be happen with the tissues? Let's say, look, guys, you must know all arteries which is possible to ligate and all arteries, which is impossible to ligate. For example, minute attention to me. In head region, all the vessels originated from carotid systems, or external or internal. I think you agree with me.
Yes.
External carotid artery, one-sided, can be closed without any problem. That if you will close external carotid artery, you remember, yeah, bifurcation, look to me. If I will propagate my thyroid cartilage, on the upper margin level of thyroid cartilage, my common carotid artery divided into two terminal branches. Now my third finger is called external carotid artery. My second finger, internal. Again, I say you, ligation of one external carotid artery doesn't give any complication. Now look to my fingers. Ligation of internal carotid artery, 100% mortality.
Damage the brain.
Laryngeal artery.
Because it is supply the brain. Unfortunately, inside of the brain, no so good communication in right and left side. Galesian circle and 3 arteries, it is not enough. If you will ligate it internal carotid artery, remember please, 100% mortality. Now look to me. If you ligate it common carotid artery,
Is mortality.
60% no problem. 40% different problems. From this 40%, 10% will be mortal. Now explain how it's possible. I ligated only one branch, 100% mortality. I ligated main artery, majority of cases not mortal. Ideas. Let's draw. This is our bifurcation. This is external, this is internal. This is another side. External, internal. Now, then I ligate it external in one side, no problem. Then I ligate it internal, 100% mortality. Then I ligate it common, 60%, no problem. For the problem, for 40%, different type of problem, up to mortal. How it's happening? An understandable, yeah?
Yes.
But it's very understandable, yes. We have so-called retrograde supplement. Look, if I will ligate it one common artery, blood from one external will come to another external and will go to internal one. Then you close internal, it is impossible. Blood cannot go to another side because internal is closed. You can ask me now, but why 40%? Such kind of the person can have problem. Different situation. Problem number one. Unhappy person doesn't have good developed anastomosis. Reason number two. Again, unhappy person because stupid surgeon treating. What does it mean? Then you apply here ligature. It should be minimum 5 centimeters below the bifurcation. If you will apply it near the bifurcation, you can close this way because thrombus will form here. Let's say partly it is because of the surgical mistake. You understand me right now?
Yes.
Let's say remember, please, this is all vessels which is supply your head region. Only in some critical situation, the war situation, not in hospital, you can ligate it common carotid artery. Generally, it is forbidden. Generally, you must selectively find the external one if it is necessary and ligate it. But literature shows that it is possible, and you can do it in more critical situation. Now let's come to, let's say, you understand?
Yes.
How permanently we arrest bleeding outside of the womb. Yeah? Ligation in distance. I make the new access, new incision. I find main artery, and I ligate it artery outside of the womb. Now we come to the technique, and you see why I say that we can ligate it vessels and inside of the womb and outside. But technique of ligation is same. Right place. For big arteries, we apply 3 ligatures. two ligature in proximal end and one ligature in the distal end. For anastomosic vessels, which we studied, we apply two ligatures in proximal end, two ligatures in distal end, because both ends give bleeding. Right, please. First ligature in the proximal end or in the proximal and distal end, yeah, if both is ligated by two ligatures, yeah. First ligature we tie loosely. It is just to decrease the lumen of the vessel. Second ligature we tie strongly. It is close completely the lumen of the vessel. Look on the picture. This is the artery which I want to ligate it outside of the womb. This is proximal end. This is distal end. For example, this is artery without anastomosis. What should I do? On the proximal end, I apply two ligatures, number one and number two. On the distal one, I apply one ligature, number three. Same I can draw inside of the wound. This artery is cutting. Again, this is proximal end, this is distal end. Two ligatures I apply in the proximal end, one ligature I apply in this. Let's say this is outside of the wound ligation, this is inside of the wound ligation. I see the damage artery. Here I don't see the damage artery, I see main artery. Or vice versa, 2, 2. It means 3, 4, 1, 2, 3, 4.
In case of anastomosis.
For anastomosis case. Now, general rule, remember, please let's clean these four. Classically, let's speak about just artery without anastomosis. Right, and remember, ligature number one, we tie loose. Ligature number 2 and 3, we tie strong. Why? Pay attention to me. Ligature number 1, decrease the pressure.
Yes.
Ligature number 2 and 3, stop the pressure. You can say me why it's necessary to apply two ligatures in proximal end. Simply, guys, pressure is very high.
Yes.
If you will apply just one ligature, stream of the blood can clean it and gives the secondary bleeding. You can ask me why both these ligatures we don't tie strong. If I will tie both ligatures strong, during the time between the necros will be formed, one ligature will be loose, and still I will have one ligature which can be clean. As I remember, this is strong rule. Tie first ligature loose, second strong. In proximal end. In distal end, same. If one ligature tie strong, if two ligature again. First ligature, because here will be in this direction. Yeah, for anastomosis. First ligature, fourth ligature tie loose, third ligature tie strong. I think it's very simple, but it's not finished. Now look here, please. Then you make ligation in distance. After applying of the ligature, right, and remember, take the scalpel and cut the vessel between the ligatures. Doesn't matter how many, here can be 4 or 3. Situation is same. For anastomosing will be 4, for non-anastomosing will be 3. Anyhow, cut the wall of the vessel. Who can tell me why? To answer in this question, you must have good knowledge from your anatomy, which you studied before. Why it's necessary to cut the vessel? Especially it is important for anastomosic vessels. Especially. Why? We cut the vessel after ligation. You see, it shows that you don't have any good knowledge from your anatomy. Look to me, everything.
To reach the organ or the...
Then you ligated the vessel. You irritated sympathetic nerves, which is located inside of the wall. Vessels have only sympathetic nerves. They doesn't have parasympathetic nerves. What is happened when your sympathicus is irritated? What is happened? Vasospasm. all anastomosis will be closed. This is natural reaction of your sympathetical system. Nerve is irritated, to the brain impulsation is go, brain is constricted your vessels, anastomosis is closed. We close main artery and we close anastomosis, necros. Then you cut the ball of artery, you make desympathization. You cut these sympathetical vessels, all the anastomosis will be dilated. You understand me or no? That's why remember, please, by the way, this is method of treatment of some diseases. For example, disease of Raynaud. Do you know what is the Raynaud disease? Spasm of the vessels in the palmar region, and it can give the necros. Usually these persons see pale skin in the fingers. What we do, we find the sympathetical nerves and cut them without vessel ligation. Just we cut sympathetical nerves. And it gives the dilatation. Instead of pale skin, they have red skin after this surgery, but it is prevented necrotization of the tissues. They understand it or not? So remember, please, that is very important. We call it the method of Opel, very famous German surgeon, Opel. Opel said one another thing also, which is very important. Opel said that if you ligate main artery, find the vein which is passing with this artery and ligate it also. If you ligate main artery, find the vein of this artery and ligate it also to prevent the metabolical problems, to prevent the hypoxia formation. Because if less blood come to him, less blood will go from him also. If you will not close this vein, the more blood will go and it will make the hypoxia of the region. You understand me or not? This is also Opel rule. Remember about it, please. Let's say this is the method of the ligation of the big vessels. Remember it, please, and let's continue. Let's continue. Time is very close or short, guys. Let's say right, please. Second type of the bleeding, it is the bleeding from the bones. Soft tissue. I think from soft tissues everything is understandable for you. Yeah, no any problem. Bones. There are two methods to arrest the bleeding from the bone tissue. Method number one, we use the bone forceps. And we partially destroy the bone in the region of the bleeding by connection of internal and external compact layers to each other. What does it mean? Hamza Jan, if it's possible, hold your hands. For example, this is the place of fracture. I see the bleeding from diploidic layer. I take the Dahlgren forceps, I open Dahlgren, upper branch I put to upper, lower to lower, and I press them. Sometimes then you eat the chicken and you press by your tooth the bone, you see that this bone is depressed. So we can connect it two compact layers to each other, and diploidic layer can be closed by this method.
Like sandwich.
Thank you very much. You understand it? This is method, now it is traumatical method. Because then you press the bone, of course you damage it. Second method is better. We have sterile beeswax. Beeswax. You know what is the bee? Beeswax. So you confused. What is the bee? What is the wax? Special beeswax. It's like glue. You take it into spatula and you apply into the place of this bleeding. Very hardly it is fused with this, we can say, cells of the diploidic layer, close all the vessels and stop all the bleedings. Beeswax is great and useful to arrest the bleeding from the bones. Let's remember, please, this is second. Now write, please, bleeding from dura mater venous cytosis. Arya, guys, in this step I will not explain you even one bleeding during all the surgery. Bleeding from dura mater venous cytosis. There are different kinds of the bleeding. and different kind of resting of the bleeding. Right, please. Situation number one. In case of the line-shaped trauma of the sinus, we apply interrupted or non-interrupted sutures using non-adsorbable monofilament threads and atraumatical cutting needles. Non-adsorbable monofilament threads and atraumatical piercing needle, not cutting, piercing. Piercing needle. Look please in the picture. What does it mean? This is the sinus. On the sinus we have the line-shaped trauma. I take the suturing material which I mentioned before and I apply the suture and close this defect. Right please, suture step must be approximately 2 millimeters. Piercing distance 1 millimeter. Suture step approximately 2 millimeters. Piercing distance approximately 1 millimeter. 1 minute attention. Case number 2. If there are defect of the sinus wall, we must make plastical reconstruction of it. What does it mean, defect of sinus? It is not line, it is aperture. Now look, she can say me, but why not take the sutures and suture? Why? Because if I will suture defect, I will close the lumen of sinus, or I will decrease it. You understand or no? This is very important. Look, hold your hands. Now imagine that here we have aperture. Of course, technically, I can take the sutures and close it, but what will be happening?
Narrow.
Narrow, thank you very much. Sign, it's forbidden. Only in case of line-shaped trauma, I can suture the bone. If it is not line, if it is aperture, I must make plastical reconstruction. Right, please, there are 3 main methods of plastical reconstruction. Method number 1 we call method of Burdenko.